Hi, my name's Alec Thompson, and this is Shannon. Today, Shannon's going to be helping me complete a thoracic and cardiac exam. So I'll begin with inspection. Just from looking at Shannon, I can see that her shoulders are even. There's no noticeable protrusions. Everything appears aligned. Her muscles look well defined for her age and ethnicity, and I don't see any obvious deformities. So we'll go ahead and go on. I'm going to start with inspecting to see if her thoracic cage is symmetrical when she breathes in and out. So I'm going to put my hands here. Just have you breathe in and out. Good. Good. So when I do that, I'm feeling and watching my hands as they rise up and down with her chest cavity to see if there's any irregularities, if one side goes more than the other. So that was fine. Both sides rose equally, so that's good to go. Next, I'm going to palpate, just see if there's any tenderness. So I'm going to lightly feel. And then I'll feel your back too. And then, did you feel any tenderness? Okay, so no tenderness there. So we'll go ahead and move on to the whisper test. So I'm going to put my stethoscope on your chest and just whisper the word whisper. Okay? And I'm only going to do this on the anterior part of the chest. Okay, so for that, I shouldn't have heard her whisper through the stethoscope, and I did not, so that is good. We'll go ahead and do the bronchotomy test. So I'm going to have you say blue moon, and I'm going to listen and see what I hear. So same thing wherever I put my stethoscope, just say blue moon. 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 Okay, then I'll do your back. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Good. So for this test, I'm listening to see if I hear it muffled whenever she says it, and I'm listening to make sure that both sounds on either side are equal throughout. And so the muffles that I heard were the same strength throughout the front and back. The only time I might have heard anything a little less was over her scapula. So that finding is normal. I'm going to go ahead and listen, do the vocal firmitis or tactile firmitis. I'm going to just use the ball of my fingers on her chest and have you just say blue moon. Blue moon. Blue moon. Good. Blue moon. And then I'll do your back. Blue moon. Okay. Blue moon. Blue moon. Blue moon. Okay, so for that, I was feeling to see if there was a vibration throughout, and there was. So that's great. And the last thing we're going to do is the egophony, is where she's going to say E, and I'm going to listen with my stethoscope again. E, 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 E. Good. 1, 2. E, 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 E. Good. So when I listen for that, I'm listening to make sure I can hear the letter E through the stethoscope and it doesn't sound like an A, and that all sounded normal. So the last thing on the lungs that I'm going to do is just listen to her lung sounds without her saying anything and just having her breathe normal to make sure everything sounds clear and there's no diminished or crackles. So I'm going to go ahead and just listen to you. So just breathe like normal. Then I'll listen to your back. So her lungs sounded clear. Throughout, in the back, it was a little bit diminished, but that's due to muscle placement, which I'm not too concerned about. Are you feeling short of breath at all? Mm-hmm. Okay. There's no crackles at the bases, so her lungs sounded great. Normal for how they should. And the last thing we're going to do is a cardiac assessment. So I'm going to listen to her different heart valves. So the first one is going to be the aortic, and then we're going to listen to the pulmonic, and then the tricuspid, and then her mitral valve. And at the mitral valve, you listen for a full minute to count the apical pulse. So I'll just go ahead and listen to your heart. Could you lift your, yep. Okay. So her apical pulse was 84 beats per minute. Her heart sounded clear. Her heartbeat sounded regular. There was no murmur. There was no third noise. I just heard the S1 and S2. So everything appears normal. And that's all I have for this assessment. Thank you.
My. Yay.
Good.